One of the benefits of the START Center is that we do have these opportunities for collaboration in cases, and we do have a very robust clinical trial division. Oncology is becoming increasingly a multidisciplinary field. And in order to properly treat patients with the optimum care, there has to be collaborative forces and planning to be able to strategize the best approach to that individual patient.
Some of the mechanisms we have within our practice is a multidisciplinary conference that we host on a monthly basis where all the different arms of the practice, including the phase 1 team, are present. We present cases, we discuss them, and we formulate a multidisciplinary plan.
I think one of the things that many patients express is a fear of the unknown, and establishing a relationship with a treating physician and treating oncologist is important to them. And often it's unnerving when they get referred to, for example, a phase 1 clinical trial or for evaluation. And the fact that we're within the same practice, we have access to their information, have easy access to their doctor who's referring the patient, and the patient does not have to leave the building, which for some people is very important. Familiarity helps with them being comfortable with their journey and understanding that, their doctors that they're familiar with are down the passageway. So I think that's important for patients. It makes it easier to discuss options for them. It makes it easier for them to understand why their doctor has referred them for a clinical trial, and also that they can feel comfortable about that process.
This patient initially presented with abdominal pain and some discomfort, and further workup revealed a mass in the pancreas, and she also had several lesions in the liver. And so in a case like this, we would traditionally think of it as metastatic disease, but the amount of disease that was present was relatively small, and therefore she would require systemic therapy up front. And so at that time, a discussion was had with the clinical trial folks to see what may be the optimal systemic therapy for this patient. And so we were able to reach out to our clinical trial folks, including Dr. Papadopoulos, and see what options were available.
So particularly for diseases where the conventional treatment is suboptimal or less than encouraging, clinical trials are an option for patients. And in this case, with pancreatic cancer, there is always a need to try and improve outcomes in patients. And fortunately, we had for this patient a clinical trial that would allow her to go on to receive not only standard therapy, but in addition, some novel immunotherapy combinations that would hopefully be more beneficial than the standard treatment that she would have received with Dr. Salih.
And this is an emerging area of surgical intervention for people with advanced cancers, but here within the START Center, we had an algorithm for offering curative intense surgery for people with advanced cancer. And when we presented her in this forum, we felt that she would be somebody that would be a potential candidate for that. And we brought her in, discussed that possibility, and she was agreeable to proceed. So we went ahead and ultimately were able to offer her surgery after we were able to confirm that all of her disease outside of her pancreas had resolved radiographically. And then subsequently she underwent resection of her primary tumor in her pancreas. And what we were really struck by when her surgical pathology returned is that there was no measurable cancer in her specimen. So she had what we refer to as a pathologic complete response, which is obviously a complete remission of her tumor at this point in time. So right now she's under oncologic surveillance.
I think it's important for us to be able to explain to them that, particularly with diseases that do not have good outcomes with conventional therapy, these are opportunities to access new and novel treatments that might actually improve on their outcome and help advance the field in terms of treatment for other patients as well. Patients are also often quite afraid of the whole process of what clinical trials entail. And I think explaining and having a support team to explain what the process is of entering a clinical trial, and also the support that is available for them both financially and in terms of resources is important in helping patients overcome their fears and reticence to participate in the trial.